A pleasant day to everyone. So today I will be discussing about pneumonia. So what is pneumonia? Pneumonia is an infection of the parenchyma of one or both lungs caused by various microorganisms including bacteria, viruses, fungi, and chemical irritants. So it is characterized by inflammations and fluid accumulation in the air sacs. So instead of air in the air sacs, in pneumonia it is accumulated by pus and fluid. So next is pneumonitis. Pneumonitis is the general term that refers to swelling and irritation, also called the inflammations of the lung tissue. Actually, pneumonia and pneumonitis are both respiratory conditions involving inflammations of the lungs, but they have distinct causes and characteristics. When we say pneumonia, it is an infection of the lung tissue, often caused by bacteria, viruses, or fungi, while pneumonitis is an inflammation of the lung tissue not primarily caused by an infection, often due to allergens, irritants, or autoimmune diseases. So, in short, pneumonia is an infection process while pneumonitis is an inflammatory response to non infectious agents. So, and now let's move on to its prevalence. So, pneumonia is a common respiratory infection affecting approximately 450 million people a year and occurring in all parts of the world. So, it is a major cause of death among all age groups, resulting in 1.4 million deaths in 2010 and 7% of the world's yearly total, and 3 million deaths in 2016, so the fourth leading cause of death in the world. So according to WHO or World Health Organization, pneumonia resulted in 808,000 deaths of children under the age of 5 in 2017, accounting for 15% of all deaths in this age group. So in 2019, pneumonia led to the death of 740,180 children under the age of 5, accounting to 14% of all deaths in this age group. So imagine a lot of people die, specifically children 5 years old and below and 65 years old and above, because of pneumonia, which is treatable and preventable. So it affects children and families everywhere, but deaths are highest in southern and sub-Saharan Africa. So next, let's move on to the types of pneumonia according to what caused it. So first, we have the bacterial pneumonia. So the most common bacterial cause is Streptococcus pneumoniae or pneumococcal pneumonia, which can affect people of all ages, especially those with weakened immune systems. So we have the Streptococcus pneumoniae or pneumococcus, which is a gram-positive spherical bacteria, alpha hemolytic member of the genus Streptococcus. So bacterial pneumonia can be treated with antibiotic and require hospitalization. Then we also have viral pneumonia. So viral pneumonia can be caused by various viruses, so including the flu, influenza, and respiratory syncytial virus or RSV, and is responsible for about one-third of all pneumonia cases. So respiratory syncytial virus or RSV, also called human respiratory syncytial virus and human orthopneumovirus, is a contagious virus that causes infections of the respiratory tract. So it is a negative sense single-stranded RNA virus. Its name is derived from the large cells known as syncytial that form when infected cells fuse. Then we have fungal pneumonia. So fungal pneumonia can result from conditions such as valley fever caused by the Coccidioides fungus. So example of this is Cryptococcus pneumocystis and Aspergillus. So then we have the walking pneumonia or also called atypical pneumonia. So walking pneumonia is a milder case of pneumonia. So people with walking pneumonia may not even know if they had pneumonia. So their symptoms may feel more like a mild respiratory infections than pneumonia. So meaning, in walking pneumonia, diri mo siya mafe-feel na may dakangayan pneumonia. And iya symptoms is mild la. So then, now let's move on to the types of pneumonia according to the areas of the lung involved or affected. So first, we have the bronchopneumonia, also called lobular or catarrhal pneumonia. So this is the most common type of pneumonia. Infection usually start from the bronchus and the bronchioles and spreads to the alveoli of the periphery. So the lobules are inflamed and consolidated. So sometimes the lobules are not inflamed but are collapsed due to mucopurulent plugging of the bronchioles which supply them. So this pneumonia is caused by pneumococcus Klebsiella pneumoniae and Haemophilus influenzae. So the onset of this type of pneumonia is low and the fever is lower. So the period of communicability remains unknown. However, it is believed that the disease remains infectious while the exciting agent is given off in the discharge from the nose and throat. So, and then we have the lobar pneumonia or the corpus pneumonia. So this is a consolidation of the entire lobe. It is manifested by chills, chest pain or breathing, and cough with blood-streaked sputum, so or prune juice or rusty. So as the disease progresses, the prune juice color of the sputum may be replaced by thinner or yellowish color. So to differentiate bronchopneumonia and lobar pneumonia shortly, we when we say bronchopneumonia, it is characterized by scattered patches of infection usually start from the bronchus and the bronchioles and spreads to the alveoli of the periphery, while lobar pneumonia involves a more uniform consolidations of lung tissue within a lobe. So, pag sinabi natin consolidation, ito yung pagdidikit-dikit ng lung tissue. And then next, we have the four stages of untreated lobar pneumonia or the anatomical stages of pneumonia. So, first stage, we have the congestion. So, it occurs within 24 hours of infection. So, the lung is heavy, the lung is dark red in color, the lung speaks upon pressure with the finger. So, pag pinisil mo siya gamit ang imo mga kuramoy or fingers, nabubuta siya or naluluho ang lungs. So, the lungs exudes a bubbly blood-tinged froth. So, naglalabas ng bula-unana na may bahid ng dugo. So, during congestions, there is also vascular engorgement, few neutrophils, and numerous bacteria. Vascular engorgement, ito yung pamumuo ng dugo sa mga daluyan or blood vessels. So, neutrophils are a type of phagocytic white blood cells and part of innate immunity. They travel to the site of infection where they destroy the microorganisms by ingesting them and releasing enzymes that kill them. So, next stage is red hepatization. So, it occurs after 48 to 72 hours and lasts for about 2 to 4 days. So, the affected lung becomes more dry, granular, and airless and resembles the consistency of liver. So, it looks like a piece of red granite. So, in this stage, there is a presence of red blood cells, which leads to color change and increased fluid, which contribute to lung consolidations. So, where lung tissue becomes firm and dense due to inflammation. So, next stage is gray hepatization. So, it occurs on day 4 to 6 and continues for 4 to 8 days. So, 4 to 8 days. So, the red color changes to gray. Then, it is softer and tears more easily. So, when pressed, it exudes a purulent fluid. So, during this stage, the lung tissue appears grayish due to the breakdown of red blood cells and the accumulations of fibrinous exudate, which makes the tissue firmer. So next stage is resolution. So it occurs between 8 to 10 days. So the inflammatory exudate is either absorbed by the bloodstream or expectorated. So during this stage, the inflammatory exudate, which contains neutrophils, fibrin, and cellular debris, is gradually cleared from the alveoli. So the alveolar epithelial cells proliferate and repair the damaged lung tissue, restoring the normal architecture of the lungs. Fibrinous material is reabsorbed, allowing the lung to return to its normal state, and gas exchange improves as the alveoli becomes clear of fluid and debris, leading to resolution of symptoms. So, another type of pneumonia, according to areas of the lung involved or affected, is the interstitial pneumonia. So, interstitial pneumonia are disorders that characterized by inflammations and fibrosis in the lung interstitium, so impairing gas exchange. So interstitium is the tissue and space around the alveoli or air sacs. So now let's move on to another type of pneumonia depending on the setting or environment where it is acquired. So first, we have the community acquired pneumonia. So community-acquired pneumonia or CAP. So these types of pneumonia develops in the community setting within the 48 hours. So common causes include bacteria like Streptococcus pneumoniae, Haemophilus influenzae, and atypical pathogens like Mycoplasma pneumoniae and Chlamydia pneumoniae. So next is the hospital-acquired pneumonia or HAP. So this type of pneumonia develops 48 hours or more after hospital admission. So following an illness or a procedure and is often caused by more antibiotic-resistant pathogens, so like Staphylococcus aureus, Pseudomonas aeruginosa, and Klebsiella pneumoniae. So this type of pneumonia can be fatal and hard to treat. So next is ventilator-associated pneumonia or VAP. So this type of pneumonia is acquired more than 48 hours after endotracheal intubation and mechanical ventilation. So the pathogens are similar to those causing HAP or hospital-acquired pneumonia, but also include Acinetobacter species. So next is healthcare-associated pneumonia, HCAP. So it's acquired when residing in an extended stay outpatient clinic or a long-term care facility such as nursing home. So similar to pneumonia obtained in a hospital, antibiotic-resistant bacteria are typically the main cause. So we have also the aspiration pneumonia. So this type of pneumonia is caused by the ingestion of gastric contents, so solid food or liquid that enters the throat and goes directly to the lungs. So this condition is often seen in patients with impaired gag reflexes and people with swallowing difficulties. So, diri ko na like explain H kay self-explanatory naman siya. Ano? So, now let's move on to curve 65. So, what is curve 65? So, curve 65, also known as the curve criteria. So, it is a clinical prediction rule that has been validated for predicting mortality in community-acquired pneumonia. So, the curve 65 is based on the earlier curve score and is recommended by the British Thoracic Society for the Assessment of Severity of Pneumonia. So, it was developed in 2002 at the University of Nottingham by Dr. Wee Shen Lim et al. So, this score is an acronym for each of the risk factors measured. So, each risk factor scores 1 point for a maximum score of 5. So, we have the confusions of new onset defined as an EMTS or abbreviated mental test score of 8 or less, and the blood urea nitrogen greater than 7 millimoles per liter, then 19 milligrams per deciliter. So there's also respiratory rate of 30 breaths per minute or greater than, blood pressure less than 90 mmHg systolic or diastolic blood pressure 60 mmHg or less. Then age 65 or older. So the curve 65 is used as a means of deciding the action that is needed to be taken for the patient. So 0 to 1 score, treat as an outpatient. So score of 2, consider a short stay in hospital or watch very closely as an outpatient. Then the score 3 to 5 requires hospitalizations with consideration as to whether they need to be in the intensive care unit. So, and next is we'll be moving on to the risk factors. So, we have young children 5 years old and below because their immune systems are still developing. Older adults 60 years old and above due to decline immune system. And then the people with underlying health conditions, for example, cystic fibrosis, chronic obstructive pulmonary disease or COPD, and asthma. So, due to damage to the lungs and difficulty clearing out germs. So, and then we have also the people diagnosed with impaired immune systems such as HIV, AIDS, cancer, taking immunosuppressive medications, so have weak immune system. So thus lowering the body's ability to fight infections. And then we also have the risk factors of the smokers and the heavy drinkers. So before we proceed to the signs and symptoms, I will discuss first the pathophysiology of pneumonia. So we have the predisposing factors and the precipitating factors. So for the predisposing factors, we have age, 5 years old and below, and 65 years old and above. So and then individual with underlying respiratory conditions and weakened immune system. So for the precipitating factors, we have smoking, alcohol use, poor hygiene, and crowded living. So first process is infection initiation or the pathogen entry through inhalation or aspirations of pathogen. It's either bacteria, viruses, or fungi. And then organism will now reach the upper respiratory airway, which will trigger the upper respiratory response. And if there is an effective defense mechanism, the microbe will now proliferate in lower airways and the alveoli. So after proliferations of the microbe in lower airways and alveoli, the local and systemic defense mechanism are disturbed. So there will be systemic inflammatory response towards invading microbes. So systemic meaning in a whole body, as well as a local response in the alveoli themselves. So first we'll talk about the systemic inflammatory response. So there is a systemic cytokine release which leads to disruptions in hypothalamic thermoregulation, which results in having fever and chills or rigor. So locally, at the level of the lungs, alveolar epithelial cells release chemokines into surrounding tissue to recruit neutrophils to the site of the inflammation. So the inflammatory response varies depending on the type of the invading pathogen. For example, Streptococcus pneumonia causes a lobar pattern of response, and Haemophilus influenza causes an interstitial pattern. So in terms of a lobar response, that basically means that neutrophils and exudate from plasma accumulate in the alveoli specific to a lung area or lobe of the lung. So neutrophils and plasma exudate then irritate the airway and attempts to clear the fluid infiltrates from the alveoli. So since the fluid infiltrates are inside alveoli, airway clearance leads to phlegm production, which results in productive cough. So, further with lobar pneumonia, fluid will build up in one sections of the lung actually doesn't allow X-ray to pass through, resulting in a white opacity on plain film at site of fluid buildup, which results in consolidation on chest X-ray. So, finally, with lobar pneumonia, a trait that is shared with the interstitial pneumonia, the alveolar sacs can be blocked by fluid accumulation, which reduces the exchange of gases like carbon dioxide and oxygen. So less oxygen absorbed means hypoxemia or low level of oxygen in the bloodstream. So similarly, less carbon dioxide excreted would lead to hypercarbia or increase of CO2 and bloodstream. So this changes in gas concentrations in the blood triggers peripheral and central chemoreceptors to increase the respiratory drive of the patient, which leads to a sensation of shortness of breath, otherwise known as dyspnea. So now, with interstitial pneumonia, so this type of pneumonia involves the accumulations of infiltrates such as inflamed cellular debris in the alveolar walls or the spaces between the alveoli and the bloodstream. So the accumulations of infiltrates in that area in the interstitial tissue thickens the alveolar walls and increases the diffusion distance for gases to have to diffuse between the alveoli and the capillaries. So that also result in the reduced exchange of oxygen and carbon dioxide, resulting in hypoxemia and hypercarbia, and triggers peripheral and central chemoreceptors to increase the respiratory drive of the patient, which leads to a sensation of shortness of breath, otherwise known as dyspnea. So, in addition, with interstitial pneumonia, the irritated alveolar walls trigger the cough reflex, but since the fluid infiltrates are not in the alveoli, attempts to empty the alveoli through coughing doesn't lead to productions of fluid, resulting to dry cough. So, note that other signs and symptoms of pneumonia exist, such as chest pain, accessory muscle use, and crackles during auscultation, so as well as fatigue. The signs and symptoms are least specific to pneumonia than the ones that is outlined on the slide. So, that's it for the pathophysiology. So, now let's move on to another additional information about the sign and symptoms. So, for the symptoms, we have here a rapid or difficult breathing, cough, fever, chills, poor feeding, wheezing, which is more common in viral infection, and then in severe pneumonia, children may experience a recession. So for the signs, we have here tachypnea, chest recession, and nasal flaring during inspection. So tachypnea, it is a rapid, shallow breathing that results from a lack of oxygen or too much carbon dioxide in the body. So chest recession or chest wall retractions often refers to the inward movement of the chest wall during breathing, so which can indicate underlying respiratory issues. So, nasal flaring occurs when nostrils widen while breathing or pagdako sa loo sa erong or itunahong ang siya. So, during palpations, there is a reduced vocal primitus, which refers to a decreased sensation of vibrations, so felt on the chest when a person speaks. And then we also have dull sounds during percussion, which is common in lobar pneumonia. So a dull sound indicates the presence of fluid or solid material in the lungs or pleural space, which can suggest conditions such as pleural effusion, lung consolidation, and tumor or masses. So lastly, on the signs, so during auscultations, there is reduced breath sounds, bronchial breath sounds, coarse crepitation, and pleural rub. So bronchial breath sounds typically heard over the trachea and larger airways, but when it is heard over peripheral lung areas where normally softer breath sounds are is expected, so it may indicate lung consolidation or atelectasis and other abnormalities. So coarse crepitation, often referred to as coarse crackles, are abnormal lung sounds characterized by a bubbling or crackling noise and usually indicate the presence of fluid or mucus in the airways. So pleural rub or pleural friction rub as an abnormal lung sound occurs when the inflamed pleural layers, so the membrane surrounding the lungs rub against each other, often due to conditions like pleural effusion, pleurisy, and pulmonary embolism. So, this type of sound is typically described as dry, creaking, or grating noise, similar to rubbing two surfaces together. So, now let's proceed to the diagnostic test. So, we have chest X-ray, physical examination, sputum test, blood test, and pleural fluid test. So, chest X-ray is a quick and painless imaging test utilized to determine if there's fluid or pus in the lungs and also determine the extent and location of infection. So, during physical examination, using a stethoscope, crackling sounds will be heard, which is common in pneumonia. So vital signs such as temperature and heart rate are also examined during physical examination. So a sputum test is a laboratory analysis of mucus or sputum that is coughed up from the lung. So which helps diagnose respiratory conditions and infections such as pneumonia, tuberculosis, bronchitis, and lung cancer. So next is blood test, which helps determine if there is an infection and what kind of infection it is. So then pleural fluid test includes analyzing fluid that is accumulated in the pleural space, so the area between the lungs and the chest wall, which helps diagnose various conditions such as pleural effusion, infections, and inflammatory diseases. So for the additional test specifically to 65 years old and above, and are in a hospital or have a serious symptoms or health conditions are CT scan and bronchoscopy. So, computed tomography scan is a diagnostic imaging technique which provide clearer and more detailed picture of the lungs. So, bronchoscopy is a medical procedure that allows doctors to examine the airways and lungs using a flexible tube called a bronchoscope, so which is inserted through the nose or mouth and down the trachea. So that's it for the diagnostic test. Now let's move on to the nursing diagnosis. So for the nursing diagnosis, it includes so we have here a impaired gas exchange related to alveolar capillary membrane changes as evidenced by altered arterial blood gases, hypoxemia, and cyanosis. And then ineffective airway clearance related to increased sputum production as evidenced by audible rhonchi productive cough and difficulty expectorating sputum. Activity intolerance related to oxygenation and general weakness as evidenced by fatigue, dyspnea or minimal exertion, and reluctance to engage in physical activities. And then sleep pattern disturbances related to respiratory distress as evidenced by increased respiratory rate, use of accessory muscles, and difficulty breathing during sleep. And then we also have altered tissue perfusion related to impaired gas exchange as evidenced by decreased oxygen saturation levels or SpO2, cyanosis or altered arterial blood gas results. Then next, high risk for infection related to inadequate primary defenses, decreased cellular action and respiratory secretions. And then altered nutrition, less than body requirement related to increased metabolic demand and decreased oral intake as evidenced by weight loss, muscle weakness, and reported lack of appetite. And then altered body temperature related to infection as evidenced by elevated body temperature, fever, chills, and increased heart rate. So, in addition, there is also an effective breathing pattern related to respiratory distress as evidenced by use of accessory muscles, tachypnea, and abnormal breath sounds. So, now let's proceed to medical management of pneumonia. So, the antimicrobial therapy varies with each agent, but then still the drug of choice for pneumonia is Benzina or penicillin G sodium. So for the causative agent Streptococcus pneumonia, the antibiotic of choice are penicillin G or penicillin V or amoxicillin clavulanate, augmentin, trimethoprim sulfamethoxazole, TMPSMC, and for its alternative antibiotics, there is macrolide antibiotic such as azithromycin, Zithromax, or clarithromycin, Viaxin, doxycycline, oral beta-lactams such as cefuroxime, ceftine, linozolid. So for another causative agent, which is the Staphylococcus aureus, penicillin is the antibiotic of choice, and for its alternative antibiotics, there is cephalosporins, vancomycin, vancomycin, for methicillin-resistant Streptococcus aureus. So for the Haemophilus influenzae, the antibiotic of choice is second or third generation cephalosporins, beta-lactam to beta-lactamase inhibitor, doxycycline, and for its alternative antibiotics, there is azithromycin and trimethoprim sulfamethoxazole, or TMP2SNZ. So for the causative agent Mycoplasma pneumonia, the antibiotic of choice is doxycycline, macrolides, and fluoroquinolone. So there is no alternative antibiotics for this causative agent. So for Klebsiella pneumonia, the antibiotic of choice is third generation cephalosporin, with or without aminoglycoside, carbapenems, and aztreonam. Beta-lactam to beta-lactamase inhibitor, fluoroquinolone are its alternative antibiotics. So for the causative agent Legionella pneumonia, the antibiotic of choice is macrolide plus rifampin and fluoroquinolone. So doxycycline and doxycycline plus rifampin are its alternative antibiotics. Then for pneumocystis, trimethoprim sulfamethoxazole, TMP-DSMZ, pentamidine plus prednisone are the antibiotic of choice. And then for its alternative antibiotics, there's dapsone plus trimethoprim plus clindamycin plus primaquine plus trimethoprim. So OTC or over-the-counter medication to relieve pain and fever are also advisable by the doctor, such as the aspirin, ibuprofen, Advil, Motrin, and acetaminophen or Tylenol. Now let's proceed to the surgical management of pneumonia. So first is thoracotomy, which involves an incision to open the chest and view the lungs so that dead and damaged lung tissue can be removed. Thoracotomy can be a life-saving procedure but requires careful considerations of risks and benefits. So next is lobectomy. So it involves removing a part of the lung affected by pneumonia. So like for example, an affected part sa natin lung is the right upper lobe of the lungs. Bali iton siya na affected part maulan tatanggalon. And then pneumonectomy, defined as the surgical removal of the entire lung. So kung sa lobectomy ang tatanggalon is part of the lobe laan, sa pneumonectomy entire lung ang tatanggalon. It's either left or right lung, depending on the affected part. So then, lastly is chest tube, a surgical drain that is inserted through the chest wall and into the pleural space or mediastinum. So, ini common na siya sa atma, imod tayo ni danay na procedure sa NSPH. So, where a flexible plastic tube inserted into the pleural space. So, the area between the lungs and the chest wall to remove air, fluid, or pus. That's it for the surgical management. So, now let's move on to the nursing management. So, first, maintain the patient's airway and adequate oxygenation. Teach the patient how to cough and perform deep breathing exercise to clear secretions and advise him to do this often. obtain sputum specimen as needed, and teach the correct collections of a specimen, and then maintain adequate nutrition to offset high calorie utilization, then provide a calm environment as the patient needs rest, control the spread of infection by disposing secretions properly, control temperature by doing cooling measures, then monitor vital signs closely and watch for danger signs like marked dyspnea, 3D, small irregular pulse, delirium with extreme restlessness, and then cold, moist skin, and cyanosis and exhaustion. So, dito ko na explain ang nursing management kay self-explanatory naman siya. Now, let's proceed to the prognosis of pneumonia. So, with treatment, most type of bacterial pneumonia will stabilize in 3 to 6 days. So, it often takes a few weeks before most symptoms resolve. So, X-ray findings typically clear within 4 weeks and mortality is low, less than 1%. So, in persons requiring hospitalization, mortality may be as high as 10%. And in those requiring intensive care, it may reach 30 to 50%. So, for the prevention, vaccination is always necessary and important. And for the pneumonia vaccine, we have pneumococcal 13 valent conjugate vaccine or PCV13 with a brand name Prevnar 13 necessary for children as part of their regular immunization schedule at 2, 4, 6, and 12 to 15 months, and also given to older adults who need it. So there's also pneumococcal 15 valent conjugate vaccine or PCV15 with a brand name Vaxneuvance necessary for adults, and then pneumococcal 20 valent conjugate vaccine or PCV20 with a brand name Prevnar 20 also necessary for adults. So there's also pneumococcal vaccine polyvalent or PPSV23 with a brand name Pneumovax 23 necessary for children 2 to 18 who need it and adults who receive PCV 15 or who have received PCV 13. So, in addition to prevention, it is a must to practice good hygiene, wash your hands regularly, maintain a healthy diet, get regular exercise, and don't smoke or quit smoking. So, now let's proceed to complications of pneumonia. So, first we have emphysema, infections of the space between the membranes surrounding the lungs and chest cavity. So, ito ay isang kondisyon kung saan may naipong nana or pus sa pleural space, ang espasyo sa pagitan ng baga at ng pader ng dibdib. So next is pericarditis, the inflammations of the sac surrounding the heart. Ito ay isang pamamaga ng pericardium, ang membranous sac na nakapalibot sa puso. And then endobronchial obstructions, blockage of the airway that allows air into the lungs. So, then there's also atelectasis, collapse of an entire lung or an area within the lung. So, ito yung pagkakaroon ng pag-collapse ng baga. Ito ay isang kondisyon kung saan ang mga bahagi ng baga or alveoli ay hindi nagiging puno ng hangin na nagiging sanhi ng kanilang pag-deflate. Then, lung abscess, collections of pus in the lungs, pleurisy, inflammations of the thin membranes between the lungs and rib cage. And then, we have the also septicemia, infections in the blood that originated elsewhere in the body, and sepsis, a life-threatening immune reaction to septicemia. Worsened chronic conditions, so pneumonia can exacerbate conditions like congestive heart failure and emphysema. Then there's also death. In severe cases, pneumonia can be fatal, especially in vulnerable populations like young children and older adults.